2014 to 2019, there was a 400% increase from 3,000 people to 14,000 people leaving the country in search of, better healthcare.
Some people don't trust the infrastructure in their countries, so it's not like the country cannot handle it. Yeah. Because if you check in some cases, it's actually the hospitals that refer them abroad.
The lady, like, she needed an interpreter, and then the interpreter was interpreting
nonsense,
something entirely different, and it was very scary because they could have missed a part of, like, they could have missed something that was, like, very, very important.
Traveling out is not actually helping the country that you're living. You're empowering the host country that you're going to.
Yeah. Especially India. I remember growing up, like, if you want to have, like, a major surgery or a major operation, like, India is, like, your best bet. And I wonder why, because, like, what is, like, happening?
You see that it's not just limited to a particular continent.
Yes. Because if the healthcare system is working from the grassroots, nobody would want to go out.
No. What procedures people commonly go out for?
So we have cosmetic surgeries.
BBL.
Welcome to the Timeline Show.
Hi guys, welcome to another episode of our Timeline podcast. Today we'll be discussing medical tourism. In this episode, we seek to uncover the challenges and opportunities inherent in the global phenomenon of seeking medical healthcare services abroad. I am Jennifer Egenti, and I have Precious and Blessing, a public health practitioner, to drive this issue. Hi girls, how you doing?
I'm fine, Jennifer. How you doing?
Hi,
Blessing.
I'm fine.
Thank you for joining us.
Thank you for having me here.
Thank you both for joining me. So let's get into it. Medical tourism, when you hear tourism, you think about vacation, think about, flexing. Well, it's kind of the same with medical tourism, just in this case, you're going there to seek treatment abroad. Yeah. And it's something that is really prevalent because a lot of people keep leaving, keep going outside to seek medical treatment. Let's have your definition of medical tourism.
Okay, medical tourism simply means, you flying out of your hometown or your country to another country to seek for, medical help. Yeah. It could be treatment, it could be consultation, it could be any form of medical treatment actually. Just you traveling from your country to another country to seek medical aid.
And, there are a lot of places because, we cannot just wake up one morning and decide to go to one particular place. There are lots of popular destinations that people go to, for treatment.
Yeah, you can't just go anywhere now to go and get treatment. You can't say you are living, for instance, an African country to another African country.
No shade.
It depending, on what you're actually seeking, that would determine your, destination. We have some, basic popular countries that people often, go to for different medical tourism centers, as I like to put it. So we have India, we have Thailand, we have Turkey, we have Singapore, just to mention a few of them. These are destination for medical tourism.
Especially India. I remember growing up, like, if you want to have, like, a major surgery or a major operation, like, India is, like, your best bet. And I wonder why, because, like, what is, like, happening? It is worth asking. But then before I go there, I just want to ask, this one is, like, on a very personal level. Do you think that medical tourism is a good or a bad thing?
So personally, I don't feel like you should take a side, because depending on what you need, if your country don't have, like, the infrastructure to, cater to that need, you should travel abroad,
to get it.
But there are some illnesses that your country also can handle. Then you stay at home and, get treated.
So what procedures, are, like, commonly, what procedures people commonly go out for?
So we have cosmetic surgeries.
BBL.
Most especially.
So they have BBL, they have gastric slim, all of those cosmetic surgeries. Then you have fertility treatments as well, and then some people travel abroad to get dental treatments also. Some people do that. I know, like, one or two people that actually did that for dental care. And then we have, major surgeries, like when you want to have like organ transplants, when you want to do like bypass on the heart and all of those things. So major surgeries, then you have cosmetic surgeries, and then dentals and fertility treatments.
Even cancer and the likes. I'm like itching to ask what the factors are, like what makes people go out of their country, right? But I feel like that's pretty obvious. So the question I'll ask now is a bit tricky, because for like illnesses or treatments that is like available in the country, why do people now leave their own country and go to another country for something that can be settled in your country?
So sometimes some people don't trust the infrastructure in their countries. Do you understand?
Yeah.
So it's not like the country cannot handle it.
Yeah.
Because if you check, in some cases, it's actually the hospitals that refer them abroad. Do you get? So sometimes it's not like they don't have those equipment to treat those illnesses in the country, but the person, probably a personal reference, don't just trust the infrastructure that they are working with in their country. So
then this medical tourism is something that affects basically everybody in the world, because when we think about people that leave their country, like, okay, Africans, we leave our country, but even in the United States, they also live there. Then in Costa Rica, during 2014 to 2019, there was a 400% increase, looking at more than from 3,000 people to 14,000 people leaving the country in search of better healthcare. So you see that it's not just limited to a particular continent. But now, speaking of the effects, now you spoke about they don't trust the healthcare system. But how about cost? Like, it's actually an issue. Like, cost is the reason why people go
abroad to get treatment. Yes. So on that cost, actually, it's also tricky, because right now I think most countries, they work with dollar. So if you are going to, let's say, a country where the dollar rate to your own currency is cheaper, obviously you get cheaper cost for that particular procedure that you want to go for. But if it's high, it's also high. So it's actually a tricky one, because depending on where you're coming from, that will determine if it will be cost effective or not for the person.
Thank you for answering that, because I was actually wondering, because the CDC says that CDC highlights that as one of the advantages of medical tourism. So I was wondering if it would like not be higher or
it
something.
Just depends on where you're coming from. So imagine someone from the US now going to India. Obviously, it's going to be cheap, compared to where they're coming from. But if someone from an African country like Nigeria going there, obviously it's going to be like higher. So it just depends on where you're coming from and where you're going to, and what's the transaction rate.
So what other factors then pushes people to leave their country for better healthcare system?
Yes, as also mentioned, we have infrastructure, your health care infrastructure.
System,
some people don't actually have all of these structures in place to carry out these procedures for them. And then you now have the cost effectiveness of the procedure that you're going for, and then you have you're going there to meet experienced healthcare providers, people that probably that is like the only thing that they do all day, all night. That is the only procedure. Once they are coming out,
their niche.
Exactly. So that is where they focus on. So they tend to like trust these people, because they know that they have experience, they have years, they've built experience over the years. Or like where you have someone that just started up and then you're submitting your whole body to that person. Some people don't, you can't take that risk, it's their life. So some people would not buy the idea of submitting themselves like that to somebody that just started, even though the person that you're going to meet actually started from somewhere. So that is some of the factors.
Okay, so talking about medical tourism, you highlighted the fact that, for instance, people in US, UK go to India, and so it's not like their healthcare system is like bad. It's just that there are some people that are just specialized in it. But then, so let's bring it down to Nigeria now, for instance. What do you feel like the Nigerian healthcare system can do differently? Because I mean, it's a different thing when they are leaving like US, for instance, just for like one particular thing. Like they know that, I can just go there and come back. But like for most people, especially in Nigeria, they are going there because that is like their last hope. So like what can be done differently? Like what do you feel like can be done differently in Nigeria to like, because I mean, you said it's not like a good thing or a bad thing. So I mean, but we cannot just say every Nigerian should go abroad when they need something as little as, let me say, just for body checkup. So what do you feel like Nigeria can do differently to make sure that people don't exactly live like that?
Okay, so depending on what is taking you abroad, the surgery or whatever procedure that is taking you, abroad, I feel like what we can do differently, especially in like Nigeria, is to invest more in our healthcare infrastructure, and then the professionals that we have here, invest in them first, because investing in them would actually now help us as a country to even grow our economy. Because then we don't have people that are taking these monies outside. You get,
it's coming back.
You are now, yes, exactly. You are now looking at the cost effectiveness of these procedures, and then giving training our professionals here that we have, investing in them, because it's you can't say you just want to you if you don't make any investment, you cannot expect a return, right?
Sure. So
you have to now invest in our healthcare infrastructure, build up centers where people can go to train these personnel, and then pay them well as well. And then you would see that they will do their job with love and even care, and then you have will not have all of these issues happening.
Now, on the risk factors, we have confidentiality. I think confidentiality is the reason why people leave. Now, there was a time our former president, went abroad for medical checkup. He did not even reach the airport, and we already knew he was out.
Yes.
Yeah.
Now, there are lots of top politicians that have health problems, and they feel like when the opposition knows about it, they can use it against them. Like, oh, don't do this. What do you think about confidentiality being a reason why people leave the country, to seek treatment? Because there's supposed to be this doctor-patient privilege.
But it does not. Actually is, but if I'm going to come down to Nigeria, this is like a personal opinion, by the way.
Okay.
I feel sometimes our healthcare systems, if in a hospital setting, when a patient is, on the bed, by the bedside, you have your medical records there. Anybody that is a staff there can come and go through your files. So sometimes I feel like people can be mischievous. Do you understand? So it's not majorly on the healthcare provider themselves. Some people can just be mischievous. A cleaner can come and have access to that, because obviously you would not even know that the person is not, because they all wear similar clothes and outfits, you get. So sometimes it's not even majorly on the healthcare providers. It's just that human beings generally, they are just mischievous, and they are looking out for ways where they can get benefits, you get, especially in our country like this. Because if I come and meet you and sell the news to you, you'll pay me now,
of course.
So exactly, so I feel like people are just mischievous. So it's not majorly on the healthcare providers, you get. Although sometimes it can also be to them, because if I'm a healthcare provider, I'm providing healthcare for probably someone that is holding a position up there. And then I just go home and I'm relaxed and I'm talking to my wife or my husband. I'm like, this person came to the hospital today, because you are obviously conversing with somebody that you trust, right? And then that person now, out of they are just free with their friends, they just talk, and then they mistalk sometimes. So it's not, most times it's not an intentional thing, you get. And then the information just gets to the wrong hand, and then boom, it's out there.
Well, to add to that, my personal level, like I feel, and that is why people leave, is to combine treatment with enjoyment.
Vacation.
Because tell me why you went to do kidney transplant and you're snapping picture in front of museum. How?
Like how did you get there?
Some people just want to go out and breathe fresh air.
Sure.
Like breathe another air that is not hot like you get. That is not as hot as Nigerian air, and then see other people, see places actually. Sometimes it's not even necessary, because right now they're even doing some cosmetic surgeries here in Nigeria, but people still prefer to travel out, you get, because then when you are healed, when you are you can still easily go back for your checkups and all of those things and follow up. Although those are some of like the effects of medical tourism, but then you are going there, you are coming, you are going, it's just leisure and treatment, so it's like leisure and business together.
So medical tourism involves leaving your country to seek healthcare outside. Can you tell me the advantages?
So it's beneficial to people that you are going to. Now, if you are traveling from, say, an African country to like India now, it's obviously going to benefit Indians, because you are paying them, you are adding to their community first off. You are going there, the professional that is treating you is getting more experience. So now they are getting, exposed to different body types. It's no longer themselves.
Yeah.
So now we right here, we digest a whole lot of things that are different from what they digest, which would now, sometimes it differs, the body mechanism just differs, so you are giving them experience, giving them exposure, although the disadvantages are like there, but then you're adding majorly, you're adding to their economy, which is obviously something that is very, very
practical.
Exactly.
Okay, before we get into these advantages, we'll be going on a break now. When we come back, we'll continue the conversation. Stay with us. The first season of Timeline is on. The journey so far has been amazing and impactful. The world needs change agents. The world needs me, you, and all of us. Join me on Timeline as we continue to share important information and discuss social issues that would help someone out there. Let's continue to advocate for critical changes on issues affecting our world today. And together, amplify messages that prefer answers to burning questions. Our journey continues as we create awareness and promote shifts in health matters and other social issues that will alleviate personal and communal struggles, guided by international laws and best practices. Join me on Timeline exactly 7 p.m. every Friday on Lead Network's YouTube channel. Subscribe, like, and turn on the notification button. You can become an agent of positive change by dropping your comments in any of our episodes as a contributor or as a professional. Join the conversation respectfully. Welcome back. We're still discussing medical tourism. Now we've talked about the advantages that the destination countries have when it comes to people entering their country to seek healthcare system, healthcare treatment. But now let's look at the risk on the patients. They go there to seek treatment, but there must be risks that
are attached to it.
Yeah, there are risks. Some of the risks are when, for instance, someone that is going for a kidney transplant, they are prone to infections, right?
Yeah.
So now you have the travel risk because you are going to be exposed to a lot of things, and which is now putting the patient at risk of getting, infection.
Yeah.
Some other type of infection because they're already prone to get to all of these things. So now you have the travel risk, and then also the communication barriers as well. If you are coming from a country where they speak majorly English, or we communicate with English, and you are going to a place where they don't speak English at all, now you need like a translator. So now there's like a communication barrier between the patient and the healthcare provider or structure that they are going to. And then also there's also how do I put this, for the patient that is going there, if some people are, I'm looking for the right word to use. Sometimes when you go to a country where they don't really, you have to start dressing like they do, you have to talk like they do, not to now talk about your skin color, because let's not even go there. Some of these people, if you are black, they will not touch you. If you are white, they will not touch you. Do you understand?
Yeah.
So some of these things are also risk, because when you now go to a country where they now sort of discriminate, it might not be outright discrimination, but then you would know that, okay, this person is treating me differently from their people, which is also, you probably might now get not the standard of healthcare that you expected or that you should have gotten. You now get something less, but then you would take it because you already signed up for all of that. So these are some of the risks for the patient that is traveling out there to get.
When we were talking about communication barrier, I just remember that I was reading an article, and then the lady, she needed an interpreter, and then the interpreter was interpreting
nonsense,
something entirely different, and it was very scary because they could have missed a part of, they could have missed something that was very, very important. She had to get another interpreter, so it is a big deal.
It is
all of continuity of care, because you mentioned that some of them, they still go back to follow up, but there's some people that they had to crowdfund for them to and it means that they will probably never have money to go back again for it. So
it's also a risk actually that you even, thank God you mentioned, it's also a risk, because now if you cannot go back for your follow-up and then checkups of it also puts you at risk. You get, because now if you have the leisure, you can now do telemedicine where you now have to call your consultant and all of that. And sometimes the things that they are actually supposed to help you do, you now have to do them yourself. You get, or better still, you now have to fall back to the one you left here. You now have to fall back to them, and still the doctor you are falling back on has to still communicate with, so they don't misinterpret each other or do something that they are not supposed to do. So it still puts the patient at risk actually. But if you have the funding to be traveling back for checkups and all of that,
it's way better.
But if you don't,
so you're talking about how healthcare systems maybe in the host countries can like communicate with the healthcare providers in the other countries. Now let's talk about collaborations from countries to countries. How effective do you think that collaboration is to ensure that people leaving the country, like people living in the host countries, no longer go there as much as they do? Because I was reading an article that said Nigeria, I think in 2023, Nigeria spent almost $8 billion just on healthcare services, like going to the other country. So can you like shed a little light on that? So
more can actually be done in that regard actually, because traveling out is not actually helping the country that you're living. It's not helping at all, because first of all, you're empowering the host country that you're going to. You get, so if more can be done in like collaboration. So now, if let's say a specialist clinic here is collaborating with another specialty clinic, and then the patient is aware, so they don't feel like it's just they don't feel like they had to or they should have, because they know that what the information they are getting is the same information they would get there. The treatment they are receiving here is the same thing that they are going to receive when they travel out or if they travel out. So they are confident in the system because they know that there is collaboration between the two bodies.
And speaking of collaboration, I saw that India is set to partner with Nigeria in terms of sending their specialists to
come and train us. That was the reason why before the break I asked if it is like if you can see it as a good thing or a bad thing.
It
because
actually is, because now we're now going to have like trained professionals.
Yes, here in our country.
For more experienced people. So there's no need for you to now, for anyone that wants to travel to now travel, because the people you are going to travel to, they are here. They've already trained the professionals here, so you just have to now stay here.
So even if the numbers are not like reducing because of cost, for instance, at least they're reducing maybe because they don't have like the right facilities, not because they don't trust the healthcare system, because now we already have like the trusted people here with us.
Exactly. So in addition to collaboration and partnership, what other ways can be done to reduce the risk associated with people that go out to travel? You talked about travel risk and everything. What ways can be done?
So I would take us Nigeria here as an example. There is a hospital that have just Turkey doctors. It's a private hospital, obviously.
Of course.
They have infrastructure. They have the equipment for everything. So now, that's already, you obviously feel like you're abroad when you are there, because that is the quality of care you are getting. So now, if they are going to refer you abroad, it's going to be easy for you. That is if, like, it's huge on the if, because the probability of it happening is very slim. You get. So now, if local healthcare systems can collaborate with them, it will just make things easier, because now you've reduced the risk of you traveling and getting infected. The cost of everything, depending on your country currency equivalents, and then you are not even exposed to all of those things. You are there. The test you are carrying out, you are already at the hospital, so you are safe. There is no risk that you are trying to prevent. And
even the communication barrier, because even if the doctors that are there don't really know exactly.
So the basic thing, so you are communicating effectively. They are telling you what they need from you. You are telling them how you feel, and communication is smooth. They are not exposed to any other infection that when you would get if you were traveling and all of that stuff. And you have the equipment, so there is no need for you to now travel abroad.
Now, on the local healthcare system, we talked about how people live. It empowers the healthcare system out, and during our conversation, we mentioned a little of the effect it has. But now let's talk about it now. The effect that medical tourism have on the local healthcare system?
Yeah.
The country that is being left behind, because
Okay, so if for the country that is being left, that has been left behind, as you said, they would have low revenue because now people are carrying the revenue that is supposed to, grow the healthcare system. They are taking it out. So now there is no money to invest back into the healthcare system to grow it.
Yeah.
And then also there are no jobs because now if imagine if most people are traveling, who would now take care? Because now the doctors are going out there because even the people are going out there to get to get the care.
Yeah.
So doctors are traveling, patients are traveling. So now there would be no jobs, right?
Yeah.
So employment rates would reduce as well. That would now cause still the economy is going to be affected hugely because now it now feels as though you are training people but they are leaving.
Yes.
Do you get it's the same way where people would go to school and then they will not travel out. So we educated you to come and help, but then you're traveling out. You get because of some of the issues that people have probably personally or just as a country. So the revenue would decline, and then you would not have staffs, you would not have professionals that would even cater for the minor issues, minor healthcare issues that we have. So that would obviously now impact on the health of the people. So production as well would be low.
Yeah.
Most major things that humans are supposed to do freely would now be low because of the fact that we don't have healthcare providers, we don't have systems that work, because now people that are supposed to make the system work are not around. They are not here. They have traveled out. So now that's where we now have where the brain drain, where a specialist, probably a general doctor now, you're supposed to just be treating malaria and fever and all, but now you are in the emergency ward, you are doing consultation, you are doing surgeries, they are calling you for delivery, just you get. So now the workload will now be too much for one person, and then so now cause a whole lot of issues.
Okay, so before the break, you were talking about what Nigeria should do differently. But then let's highlight the fact that it is not only Nigeria that suffers this problem. So what do you feel like is a foreseeable future? What do you feel like people can do differently to make sure that other people even stay in their own country as well?
So I just feel basically the government should invest in the infrastructure of the healthcare system, because if the healthcare system is working from the grassroots, nobody would want to go out. Do you understand? Because if somebody has probably, let's say, an injury now, for instance, and then you are sure that if I go to my primary healthcare, which is the first healthcare system you have access to, you know that you will get a solution for something as little as that, and then you come with a bigger problem, probably a CS section, and it's successful. So now you are building success stories because the government has invested in the healthcare system. Not some communities, you would go there and probably during an CS, we watch it, I've not experienced, but watch it in movies where they are carrying out an operation and then light is off. So do you get? So all of those things, if you invest in the healthcare system, we would not have any of those things. Especially during a major surgery or operation going on, you will not have all of those issues because they are, first off, you have the manpower, you have the professionals there, and then the system the structure is working effectively. The people would obviously trust the system to come there. So from there, you would now build trust for the
healthcare system
as a whole, the healthcare system as a whole.
Oh guys, there you have it. See, medical tourism is something that affects both the host countries and even the destination countries. And from everything we've spoken about, you see that we need international collaborations. We need the governments to improve the healthcare of even Nigeria and other countries. It is very important that we understand that in as much as people are living, it is best to give them the proper healthcare there, so that most of the issues they are traveling, their travel risk associated with it, you inform them on time before they go, so as to mitigate this risk. I'm really thankful, that we have you here to talk about this issue. I really learned a lot. Don't forget to keep the conversation going in the comment section. Keep it respectful. Follow us on our social media platform at Healed Network. I am Jennifer Egenti.
I am Precious Jacob.
And this is Blessing. I will be seeing you soon. Bye.